Imagine waking up tomorrow morning, sitting up in bed, and reaching for your glasses.
You put them on, expecting the world to come into focus.
But this time, something is wrong. One of your eyes isn't working properly.
It isn't just blurry, like when you need a new prescription.
It feels as though someone has lowered a dark shade over the top half of your vision. Or perhaps the world has simply gone gray and dim in one eye.
There is no pain. Your eye isn't red. You don't have a headache.
You assume it's just a smudge on your glasses, or maybe you slept on your face funny.
You might even think, I'll call the eye doctor next week. This reaction is the most dangerous mistake you can make.
What you are likely experiencing is not an eye problem. It is a vascular event. It is a stroke.
But very few seniors are aware that a stroke can happen exclusively inside the eye.
And just like a stroke in the brain, an eye stroke is a race against the clock.
If you wait, you may lose your vision in that eye permanently.
Before we dive in, if you haven't subscribed yet, hit that button.
One, the anatomy of a heart attack in the eye.
We often think of our eyes as cameras, separate tools that capture light.
But biologically, your retina is actually an extension of your brain tissue.
And like the brain, it is incredibly hungry for oxygen. The retina is fed by a single, tiny pipeline called the central retinal artery.
This artery is very narrow, about the width of a sewing needle. As we age, plaque builds up. Sometimes a tiny piece breaks free.
It travels up through the neck and flows into the head. Eventually, it reaches that tiny artery, and it gets stuck. In an instant, the blood flow stops.
It is exactly the same mechanism as a heart attack, but it is happening in your eye.
The moment that artery is blocked, the cells in your retina begin to suffocate.
If this happened in your finger, you would feel throbbing pain. But the retina does not have pain receptors.
That is why an eye stroke is so deceptive. It happens in complete silence. The only signal you get is the loss of function. The lights simply go out. It is a physical blockage in a vital pipe.
Causes devastating, often irreversible damage. Allows you to see the faces of your grandchildren. 2. The curtain effect, amaurosis fugax.
Medical professionals call this specific symptom amaurosis fugax.
It translates to fleeting blindness.
Patients often describe it as a shade or curtain being pulled down over one eye.
It starts at the top and moves downward, or sometimes from the side.
This happens when a clot temporarily blocks the retinal artery and then dissolves or moves.
Because the vision often returns, many seniors think the danger has passed.
But this is a warning shot from your vascular system. It means there is likely a larger source of plaque in your carotid artery that could send a bigger clot to your brain, causing a massive stroke.
Three, the painless trap.
Ouch!
We are conditioned to believe that serious injury must hurt.
But an eye stroke is almost always painless.
The retina does not have pain nerves like your skin does.
It can suffocate and die in complete silence.
Unlike a heart attack, which feels like an elephant on your chest.
This lack of pain is a trap. It tricks you into waiting.
You might think, I'll just wait and see if it clears up.
But every minute you wait, retinal tissue is dying permanently.
Do not just rub your eye and hope for the best.
4. The critical 90-minute window. The critical 90-minute window.
In a brain stroke, we often say, time is brain. In an eye stroke, time is sight.
Retinal tissue has an extremely low tolerance for lack of oxygen.
Studies show that irreversible damage begins within 90 to 100 minutes. After about 4 hours, the vision loss is usually permanent and untreatable.
This means you cannot wait for an appointment. You must go to the ER immediately.
Doctors can try to dislodge the clot, reduce pressure, or use clot-busting drugs.
But these treatments only work if applied immediately.
Speed is your only ally.
5. Giant cell arteritis.
5. Giant cell arteritis pros 15. The inflammatory cause.
Sometimes, an eye stroke isn't caused by a clot, but by inflammation.
GCA is an autoimmune condition that affects seniors.
It causes the arteries in your scalp and neck to swell, choking off blood supply.
Ouch.
Symptoms include a tender scalp, pain when chewing, or severe headaches. Pain in the jaw when eating, which is a classic sign.
If untreated, GCA can cause blindness in one eye and then quickly attack the other.
It is treatable with high-dose steroids, but you must catch it fast.
If you have vision loss plus scalp tenderness, tell the ER doctors immediately.
6. The hidden link to brain stroke.
There is one final danger. The eye stroke is often a herald of a brain stroke.
Because the eye and the brain share the same blood supply, the clot that blinded your eye came from somewhere else.
Usually the heart or the carotid artery.
If you ignore the eye stroke, the next clot might be much larger, and it might head for your brain's speech or motor centers.
Studies show that people who have an eye stroke have a 25% chance of having a cerebral stroke.
Often within the next 7 days.
By going to the ER for your eye, you are not just saving your vision, you might be saving your life.
Conclusion: protecting your world.
Conclusion.
As we age, our world can sometimes feel like it is shrinking. We might travel less, but our vision is what keeps our world large. It allows us to read, to see the faces of those we love.
Losing that sense is a trauma that changes life forever. But it is a trauma that can be mitigated or prevented with knowledge.
We must stop minimizing our symptoms. We must stop trying to be tough.
If the curtain falls, if the light goes out, stand up!
Call for help. Get to the emergency room.
Demand attention for your eyes because they are the windows to the health of your entire vascular system.
You have spent a lifetime watching over your family. Now, you must watch over yourself.
Now, I'd love to hear from you. Have you ever experienced a sudden change in vision?
Share your thoughts in the comments below. Your story helps us build a community.
If you found this video helpful, please leave a comment with one.
If not, type 0. I value your honest feedback.
And don't forget to like, share, and subscribe for more content.
Dedicated to protecting your brain, your vision, and your future.
Thank you for watching, and take care of yourself.